Good afternoon. I'm Adrian Dix, BC Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our daily COVID-19 briefing. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. As you know, tomorrow we'll be issuing a written statement at about 3 o'clock to give you the information of the day. And that Friday morning, and it'll be here at this podium at 11 a.m., but there will be a technical briefing for media before that. We'll be presenting an update to modeling that we've done about COVID-19 in British Columbia. And with that, I'm happy to introduce Dr. Henry.
Thank you and good afternoon. This is the update on COVID-19 in BC for today, April 15th. We have 44 new cases that have been diagnosed in the last day in BC, bringing our total of people with positive for COVID-19 in BC to 1,561. That includes 670 people in the Vancouver Coastal Health Region, 623 in the Fraser Health Region, 92 on Vancouver Island Health, 146 people in the Interior Health Region, and 30 people in the Northern Health Region. We have no new long-term care facility outbreaks, but there are ongoing outbreaks at 21 long-term care and assisted living facilities in Fraser Health and Vancouver Coastal. And currently we're up to 265 cases associated with those outbreaks. We also have an ongoing outbreak in a nursery in the Interior Health, and we have 3 additional cases who've tested positive in that outbreak, bringing the total number with test positive in that cluster to 26. We continue to have the single case at the Okanagan Correctional Facility, and ongoing management of that facility is going. As well, we are now up to 48 cases associated with the Mission Federal Correctional Facility in the Fraser Valley, including 7 people from that facility who are hospitalized in a hospital here in British Columbia. Of the cases we have, 131 people are hospitalized, and of those, 59 people are in critical care or ICU in the province. We have, unfortunately, another 3 deaths in the last day here in British Columbia to bring our total of people who have died from COVID-19 to 75. That includes, for the first time, a death in the Interior Health Region, a man in his 60s who had been in recovery at home. 955 people are now fully recovered from COVID-19 here in British Columbia. I want to talk a little bit about some of the work that we've been doing, the hard work we've been doing to ensure the needs of all communities across the province have been addressed when it comes to preparing for and being able to respond effectively to cases of COVID-19. We recognize and have recognized from the beginning that every community is unique and they have different needs, both healthcare needs, essential service needs, and they require different levels of support. And particularly our smaller communities and more remote and First Nations communities may have limited resources and services. Makes it much more challenging to address COVID-19, both in preventing it from entering those communities and responding. We know this is especially great in some of our more remote and First Nations communities. One thing that we do all have in common across the province and has been driving our response to this pandemic is that we share our understanding and the value of our elders and seniors. And that is why we have been paying so much attention to what we can do to best protect them and to protect all of those who are more vulnerable to more severe illness around the province. So resources are being created to support communities around the province, provide them with the resources they need. And importantly, we talked about some of the testing strategies that we have, and we have been able to deploy testing to better support our communities, our more remote and Indigenous communities around the province. And that's something that I think is going to be incredibly important for us to be able to detect cases early, to detect clusters of cases, and to appropriately and safely manage in these communities. One of the other things that has come to my attention in the last little while is that there have been concerns, and I've mentioned this before, that people are fearful of going into hospital or seeking medical care for the issues that they have that are not related to COVID-19. And part of that is the concerns that we have been putting in all of this preparation around being able to care for people who do have this disease. It is safe to go to the hospital, and I want to reassure people that if you have diagnostic tests that have been booked, that you've been waiting for, it is safe to go for those. It is safe to call 911. If you need that urgent medical care, do not hesitate to call for help if you need it. As well, we want to make sure that we are doing our best to protect people in our community from all of the other issues that arise that may affect our health. In particular, I want to encourage people of young children, parents of young children, to make sure that they continue with their childhood immunization programs. These are critical programs that we are preserving within our public health communities to make sure that young children in particular receive their basic immunizations and their childhood immunizations. So please be reassured that these services are still available to you, and it is still incredibly important to protect our children from the other infectious diseases that we know can spread in our communities. And finally, we have been receiving, and I've been talking a lot about the importance of us being kind and supporting each other. We are in this together, and we are in the midst of it still. We'll be presenting some of the modeling about where we are in the midst of it and some of the thinking that we have about going forward. But we are not at the point yet where we can let up, and I know that is very challenging for people. And we've heard some anecdotes mostly of people getting frustrated and angry. And I think we have to realize that this is often a manifestation of anxiety and fear that we have, not knowing about the future, not knowing what's going to happen with our jobs, not knowing what's going to happen with our families, being affected by not being able to see our loved ones. And this is a time where we really need to stand together to support each other, to respond to anger with kindness, to make sure that we can support each other as we go through the coming weeks and months, because we are all in this together. What we do today and what we do every day through this really matters. We are all making a difference, and we are getting through this together. We are supporting our healthcare workers, we're supporting people who are caring for this virus, and we need to continue to support each other in our communities to make it through this. We need to be kind, and we need to be calm, and to help each other and stay safe.
Thank you very much, Dr. Henry, and I wanted to start by joining Dr. Henry in expressing our condolences to the families of those who've passed away from COVID-19 in the last 24 hours. One, as Dr. Henry has said, in the Interior Health Authority, one in Vancouver Coastal Health, and one in Fraser Health. These are significant losses. We understand families will be grieving, and I think they tell us in the most profound way possible why we do have to be kind and pull together, because there are some people who are either directly or through a family member or from taking care of someone associated with that grieving, and I want everybody to know that we not only extend our condolences, we both Dr. Henry and I reflect on it every single day before we come down here, the cost of this for many individuals who have lost loved ones so far. And I wanted to note that as we do to talk about the acute care sector, 131 people in acute care hospitals today, of which 68 are in Fraser Health, 11 in Interior Health, 9 on Vancouver Island, 4 in the Northern Health Authority, and 39 in Vancouver Coastal Health. That we have 4,632 vacant hospital beds. That's a capacity level closer to 59% close to 59%. And then in critical care units, we have an occupancy rate of 46.3%. Wanted to add to the data I gave about surgeries yesterday that there was one data point missing from one health authority. In fact, we've completed in the period in question, which was March 16th to April 12th, 9,552 urgent and emergency surgeries, so urgent, elective, and emergency surgery. And so that we've canceled many surgeries that are elective surgeries. There continues to be work done in our healthcare system. Equally, yesterday there were 3,595 emergency room visits across BC. This compares to 6,559 on March 9th, so it's significantly under. And it reinforces what Dr. Henry has just said to you, which statistically, which is that it is safe to go to the hospital, and there will be people there to help you if you have conditions or need to either do a diagnostic test or receive care, emergency care in our healthcare system. So that's an important point to recognize. The work continues in long-term care, and I just wanted to reach out to everyone again who works in long-term care. There were, as we've said, no further deaths in long-term care, but we continue to face significant issues around long-term care, and not just issues around people with COVID-19. We understand, I think, very much the impact in a personal way, but also in looking at the changes that have been made to protect people. The consequences of that. People do pass away from things other than COVID-19 in long-term care. And one would hope that they would be surrounded, of course, in those times by family members, and that is not always possible now. And so we want everybody to understand that there is a cost to these measures. And while the measures, I think, are absolutely necessary, and the evidence shows they're absolutely necessary, and they're some of the strongest that have been taken anywhere, we understand with all measures that are taken to protect people that they are not without cost. And we wanted to reach out, and I particularly want to reach out to all the families of people who have relatives, loved ones, friends in long-term care, that we understand how difficult this time is. I also want to acknowledge all of the health sciences professionals that are working across the system. We think of respiratory therapists, but so many more across health sciences professions who are doing remarkable work in supporting people both with COVID-19 in acute care and other patients in what is a very difficult time. I want to let people know over the next week there are going to be 5 virtual town halls, one in each health authority. They'll be hosted by members of the legislature from the NDP and from the opposition. Each will have a co-host, and each will involve with the CEOs of the health authorities and the medical officers of health. The first one will be Friday, April 17th in Vancouver Coastal Health, and will involve Mary Ackenhusen, Dr. Patricia Daly, Bowen Ma MLA, and John Yap MLA, and there'll be more such town halls coming up. And I just wanted to express my appreciation to my colleague in the legislature, Norm Letnick, whose idea this was originally, and we've worked together on this idea. I think it's very important that we have an opportunity, and especially in regions, for the people who are leading our efforts in these regions, the CEOs of health authorities and medical health officers, to be able to answer directly questions that people in regions have. We also want to acknowledge the work that essential service providers have done to find new ways of delivering their services safely. As an example, financial institutions have made online and telephone services more available, and we encourage you to make use of these virtual storefronts. And while some transactions obviously require people to come in branch, we ask that everybody apply the same diligence as you would to trips to the grocery store and keep them to a minimum. And I also want to acknowledge all people with disabilities in the province, and so that they understand that services and supports will be there for them if they require acute care services related to COVID-19, that their concerns are of significant importance both to people who work with people with disabilities every day and to the healthcare system in what's a difficult time, and that we are focused on their concerns and sometimes their circumstances which require special treatment. For example, the need to ensure in hospitals for people who have hearing or sight disabilities may have more need for support in hospital from people who are regularly there to support them, and we are absolutely working on all of those questions. On Friday, we'll be presenting modeling, and I wanted to just say, finally, just a word about that. We won't be doing a briefing tomorrow, but we will be providing all of the information that you have come to expect every day with respect to new cases. But with respect to modeling, I want to say this, that what we're trying to do and what we've tried to do from the beginning is why we were the first province to present modeling, why Dr. Henry and the Deputy Minister Stephen Brown gave a detailed technical briefing some weeks ago, and why we're updating it now. We want everyone to understand and see what we're seeing. This is not a turning point day. There isn't major changes coming out of what we do Friday. It's just our continuing effort to ensure, as I said, that you see what we see. And what we see is people around British Columbia who are taking part, who are participating, who are all in, who are helping to bend the curve. And now more than ever, as we see, I think, some positive indications about that and some challenges. You look at the Mission Institution, you look at other circumstances around the province, and you see what can happen in circumstances and in communities of people when COVID-19 is present. So we have to continue to, our work continue to be 100% all in. But I want to acknowledge every person in the province who've been part of this effort that Dr. Henry and Mr. Brown and so many others have led running the modeling, and to acknowledge that when we do models and we present what the circumstances are in BC, we see your effort, your commitment, your work, and yes, your sacrifice. And if anything, what we need to do, as this is working to a degree, is to continue to be 100% all in this effort in British Columbia. And I wanted to thank everybody out there for that. Je vais dire quelques mots en français. Je vais trouver mon français premièrement, et puis de dire que de signaler qu'il y a 44 nouveaux cas ont été testés positifs dans la province au cours des dernières 24 heures, ce qui porte notre total à 1561. Cela comprend 670 à Vancouver Coastal, 623 à Fraser Health, 92 sur l'île de Vancouver, 146 dans l'intérieur et 30 au nord. Nous avons maintenant 955 personnes qui se sont complètement rétablies en Colombie-Britannique. Je voudrais me joindre au Dr. Henry pour exprimer mes condoléances aux familles des 3 personnes décédées au cours des dernières 24 heures de COVID-19 en Colombie-Britannique. Les trois, je pense, et leurs familles, les familles de ces 3 personnes, pour eux, c'est une situation douloureuse. C'est douloureuse pour nous aussi. Et nous voulons présenter et exprimer nos condoléances. Je pense que je veux ajouter qu'il y a aujourd'hui 131 personnes hospitalisées avec COVID-19 en Colombie-Britannique. C'est 68 à Fraser, 11 dans l'intérieur, 9 sur l'île de Vancouver, 4 au nord et 39 à Vancouver Coastal. Et quand on regarde notre secteur des soins, il y a 4632 lits qui sont actuellement vides. Cela signifie un taux d'occupation de 58,8% dans l'ensemble du système et de 47,3% dans les lits de soins intensifs en Colombie-Britannique. Thank you very much. We're happy to take your questions.
Okay, as a reminder, please press *1 to enter the queue. You are limited to 1 question. And please take your phones off mute. You will not be audible until we call your name. First question this afternoon is from Vaughn Palmer, Vancouver Sun.
Good afternoon. Safe Care BC has released a survey of its members, almost 500 in long-term care and assisted living facilities. 70% say they are experiencing a critical shortage of personal protective equipment, N95 masks, eye protection equipment, and so on. First of all, I guess, are you aware of this concern, and is it going to be addressed?
Absolutely, and yeah, that is an issue that we've been working on, as you know, for some time. I will note that this survey was done a few weeks ago, at a time when PPE was continually tenuous in our supplies. I will also note that some of it refers to things like respirators, and there is not a great use for respirators in long-term care, for example, and they need to be preserved. So N95s, for example, are respirators, and they're used for aerosol-generating medical procedures, things that we don't, that we avoid doing in long-term care. So the focus is on what is the appropriate personal protective equipment, how is it to be used, and we do know that many people in long-term care are not as familiar with using personal protective equipment for interactions with the residents in their home. So that has been a transition. We are absolutely working in every long-term care facility in our province to ensure that every encounter with a person, a patient, a resident in that facility is done safely, and that for the most part includes healthcare workers wearing a mask for those encounters and ensuring that we have access to masks, gloves, hand hygiene, and all the other important measures that help us reduce transmission in those settings. So very much working on this.
Next question is from Andrew McLeod with the Tyee. Go ahead.
Yeah, hi. Talked a bit in the past about what's needed to go back to normal. In the last couple of days, we had, I think the European Union put out a 15-page document on guidelines of what's needed. World Health Organization had a 6-point summary of things they thought jurisdictions should be looking for. California put out its own roadmap. I'm wondering what you think of those approaches and when we might expect to see a similar roadmap for BC and what it would need to include in your view.
So absolutely, I'm very familiar with them, particularly the WHO one that we've been involved with, and a number of ones. ECDC has a very good one. There are a number of others. Our Special Advisory Committee nationally has been looking at this and addressing this issue about how do we make this relevant to where we are in our pandemic here in BC and across Canada. So we're at different places in different parts of the world, and certainly even in different parts of Canada. So there are things in there that are very relevant and that we've talked about them. You know, how many cases we have, how much our healthcare system has capacity to contract or expand, our PPE supply and how secure we are with access to it in the longer term. In the community, you know, how secure we are with our testing capacity, which has been, as we have reported here in BC, we've increased our testing capacity. I think the other piece that's really important around our testing capacity is having access in all parts of the province. And once again, within BC, we're not at the same point in all parts of BC either. And also having access to a serology test that helps us understand who has been exposed and who has been infected and who has some immunity to this would help us guide our direction. So those are all the things that we are also considering, and we are developing our roadmap both for how we will look at the healthcare sector, but also how we will look at measures that we need to continue and what we can lift within our community. So on Friday, we'll talk some more about where we are in our pandemic and how that might be reflected. And then in the coming weeks, the planning that we're doing now will be available, and we'll be sharing it with everybody as well. But I think it's really important to recognize that we are not at the end of our beginning yet. We're maybe partway through it. We're not at anywhere near the end of what we're going to do with this, and normal is going to look quite different for some time. It's not going to be the same as what it is today, perhaps, but there are some measures that we are not going to be able to stop doing until we have enough immunity in our community, what we call herd immunity in public health, until we have enough to prevent transmission and prevent lots of people becoming sick in a very rapid way. So that is the important part, and part of that is understanding who has immunity already, and the other part of it is the ways that we increase community immunity is either from people being infected and surviving, or vaccine. So those are two really important pieces that we need to consider, and we'll be talking more about that on Friday.
Nick Johansson, Castanet.
Hi, Dr. Henry. With regards to this first death in the Interior Health Region, can you say what date this man passed away on? And you also said he was recovering at home when he passed. Had he been in the hospital prior to his death? And how long before he died was he released from the hospital?
Yeah, I don't have all the details. This gentleman unfortunately died. We were notified of it in the statistics today. So yesterday was when the death was notified. I will tell you that he was mostly at home, but had gone into the hospital with an acute condition just prior to his death.
Rashmi Nair, CBC.
Hi there, Dr. Henry and Minister Dick. Hi, how concerned are you about the proposed transit cuts that TransLink is warning about? Like even prior to the call for emergency funding, healthcare and other essential workers were already saying that the reduced service is leading to overcrowding on some buses. So what can you say about that one?
So my perspective, of course, is making sure that we have guidance that TransLink is following that allows us to continue this essential service. And it is absolutely an essential service for many people. For those who live on the lower mainland, for example, healthcare workers is to be able to get to work to do the things that we need. So my important piece of this is ensuring that we have the appropriate guidance and that they're able to manage that. And I'll leave Minister Dix to talk about the money.
Obviously, TransLink's a very essential service for those of us who are responsible for healthcare. It's important for many people in healthcare to get to work, to get to long-term care homes that they work in, or assisted living, or in the community, or at a hospital. So the transit is obviously a very important thing. I know these issues are being worked on between TransLink and the appropriate ministries, and there's work going on everywhere because, as all of you know, the impact of COVID-19 on all governments, on the economy, on people is profound. So this is one area where it's significant. We hear from municipalities. We also hear from lots of people who are struggling, and certainly in my community of Vancouver Kingsway, I hear lots of that as well. So I think you're going to hear more about these issues. Nobody disputes, absolutely nobody disputes the central importance of people being able to get around and get to essential work in the community. And I know that lots of people are working to see that continues.
Cindy Harnett, Times Colonist.
Hi, thanks for taking my question. With regard to the single site order for healthcare staff in long-term care, what is your expectation for when all homes should have this implemented? Would that be summer or at least before a possible second wave? And can you explain why group homes aren't included, or is that something that you're thinking about?
Yeah, so I'll address the second part. I mean, group homes tend to be smaller. There's smaller numbers of people, and the workers who work in group homes are somewhat different than the people who are working in long-term care, the healthcare workers in our long-term care sector. So we have been looking at the important part of how we support workers who do work in our group homes and how we best protect people in that sector across the province. But with respect to long-term care and assisted living facilities and our acute care facilities, it is a complicated process in the Lower Mainland in particular between Vancouver Coastal and Fraser Health to work it all out, but I know it is ongoing, so I do expect it will be substantially implemented within the next week to 2 weeks. It's going to take a little bit of time for all the dust to settle, but I know that as well here in Island Health, where there is fewer people who are involved, and in the interior and the north, it's moving ahead as well. So I do expect that it'll be substantially complete within the coming weeks.
Next question is from David Molko, CTV.
Hi, Dr. Henry. I just wanted to ask you about community deaths again. And I understand the death in the interior is not technically a community death, but when we talk about people sort of enduring their symptoms and working through them at home. In the last community death, the one in Richmond, you talked about how you were going to look back at the process, at the monitoring, at the reaching out you were doing at that point to see what changes could be made. And I'm just curious to know, what have you learned? What changes have been made in the last week or so?
Yeah, so we focused a little bit more we focused more attention on assessing people's symptoms during the second week of illness. We've come to recognize, and this is not a surprise having lived through SARS a number of years ago, but people who have apparently a mild illness early on, it's a critical period of time around day 5, day 6, day 7, where they either start to really get better and shrug it off, or some people can very quickly go downhill. And that is a critical period of time where we're having more contact with people. We're making sure that if they are having any experience of shortness of breath or chest pain or other things that might come with having an infection that affects both the lungs and other parts of the body, that we have a low threshold for bringing them into hospital, at least for observation, where they can be closer to critical care if needed. So that's one of the things. The other one is we're making sure our algorithms for who can safely recover at home cover things like, we've always known that as you get older, your chances of having a more severe illness go up, but also covering things like people who have underlying illnesses that might make them at more risk, and making sure that we have ongoing connections to make sure that if there's any concern at all that somebody might be not getting better or have concerns that they call 811, that we have the ability to get them into a facility much quicker, just in case.
Keith Baldry, Global News.
Regarding the outbreak at Mission, people are being released from prison all the time, I assume. I don't know how many, but given that's a cluster and they're all living close together, is there any efforts made to track people when they leave that facility, where they go? Are they required to self-isolate? And also, when you say the new normal is going to look a lot different for a long time, are you referring to that social distancing will be here for a long time?
In terms of Mission, yes, we have reiterated our expectations and are working with Correctional Services Canada to be sure that when people are released, and as you say, they can be released quite quickly into our community, the expectation in BC is that when you have been in an outbreak situation like that you will self-isolate for 14 days. And we have had people who have been released from correctional facilities that have developed illness in the community. So we are going to be actively supporting people who are released from Mission, who are staying in BC, to make sure that that they can safely self-isolate and that they have the provisions they need and that they have the follow-up they need in case they do become ill in that critical incubation period. So that is one of the things that we're developing the protocols, or have developed protocols with correctional services on. In terms of the new normal, therefore now normal, some of the things that we'll be thinking about are that physical distancing. We do know that these are the things that help prevent transmission. Things like cleaning our hands regularly. So you will see us talking about that continually for the next while, because that's an important thing that we know works to protect ourselves. The concept of covering our cough, of keeping that distance. So maybe it's in a workplace where you divide people up so you don't have as much crowding in your workplace. You're not all in there at the one time. You continue to have a mix of working at home but having physical distancing when you are in the office, perhaps, or not having the meetings the way we used to have, getting used to some combinations of virtual meetings and in-person meetings when you can maintain those safe distances. Enhanced cleaning in our environment. I don't believe that there's going to be any changes to our way we're grocery shopping or going to the pharmacy in the near future. We'll need to keep those distances, those safe distances between us, for some time.
Chella Bernardo, News 1130.
Hi, Dr. Henry. I was going to ask you to elaborate on that, because I know that on Friday you're going to be giving us more projections about what we can expect. But can you give us any idea as to what kind of safeguards you would like to see in place as someone who has gone through SARS, when we're hearing that the wet markets in China are going to be allowed to reopen, things that have made people very concerned in recent weeks about what the source of this particular virus may have been, what are you hoping evolves from this situation?
Yeah, well, those some of the sort of bigger international questions, those are challenging ones, and I do have great concerns about things going back to so-called normal when we know the amount of destruction and suffering that this has caused around the world, and I can't even begin to think that we would allow that sort of return to a practice that puts people at risk again. And it's not only putting the rest of the world at risk, but putting people in those communities and in China, for example, at risk too. We are not yet through this pandemic, either here in BC, in Canada, or globally. And there's a lot of work that still needs to be done to understand how we can get through this safely. So here in BC, we'll be looking at making sure we have our that we continue to have our safe distance measures in place, our hand washing, those things that I just mentioned. And how can we reopen those critical services that we need in our community, those businesses, our economics, without losing that safety distance, but also connect our communities again and continue to connect in communities. We'll also be looking at the health system. So how do we restart those pieces of the health system that we have put on hold for a while, but do it in a way that's safe? And part of that will mean having the adequate testing that we need in our community, and we're getting there with that. Having things like serologic testing to help support us in investigation, having public health on the ground to investigate every single case and make sure that we stop those chains of transmission so we don't get explosive outbreaks like we've seen in other parts of the world. So those are the critical things. We need to find that balance, the balance between opening up, letting us get back to some of the important things that we have in our lives, including our health system, but being prepared that if we start to see cases, we start to see a surge again, we're able to manage that effectively and protect people, both who have the disease and those who are in our communities that need healthcare for other reasons. So it's the details are things we're working out right now, but it's going to be a fine balance, and it's going to be a learning experience. We're learning from watching what others are doing who are farther ahead of us in their trajectory, and we'll continue to follow that over the coming weeks.
Les Lane, Times columnist.
Well, the Premier was talking earlier about discussions and planning for a possible kind of staged resumption of activities in the not too distant future. Does the extension of the state of emergency for 2 more weeks today suggest that you're going to stand pat and hold the line for at least that period of time?
The short answer is absolutely. We've said before, and we'll continue to say, what we're thinking about is at the, after the end of April. I don't foresee any changes to what we're doing in the coming 2 weeks, 3 weeks. But in the meantime, we're still planning for what we can do once we start to get to that point where we're tipping over the edge, where the curve is not just flat, but it's come down. We're not there yet. We still need to hold the line. Really importantly, we need to hold the line for the coming weeks here in British Columbia. We are doing okay. And we're seeing that in the fact that people get the health care that they need. People are able to manage in our communities. And that's why it is so important for us to be patient right now, to be kind to each other, because it is going to be some weeks before we can let up even a little bit. I don't know if you want to talk to that as well.
I mean, the answer to the question is yes, Les. I think Dr. Henry said some weeks ago that there was zero chance of any changes of this direction in the month of April. I think that continues to be true. We have to do the work. This is an unprecedented situation in our lifetimes, I think it's fair to say. And so there's lots of work to be done. And what it says to us, though, when so many people have sacrificed so much, sometimes by choice, sometimes not by choice, that we really have to be 100% all in now. We have to continue to do what we've been doing. We continue to hold the line, as Dr. Henry says. Let's continue to bend the curve. But this is critically important in the coming weeks because what we need to do is organize in a planned way into the future. But to do that, we have to flatten the curve now. And so those actions need to continue as we show the results of those tremendous efforts by people in British Columbia and all of those sacrifices and what we can do in the future. So I think the answer to the question is pretty clearly yes.
Next question is from Mary Brooke, West Shore Voice. Go ahead, Mary.
Hi, thanks for taking my question. It's regarding seniors in the long-term care facilities. And so as we've heard, seniors who do come down with COVID in those scenarios are offered hospital care, but in many cases, or some cases, they're declining, which in a way kind of precludes their fate. So I'm just wondering if there is a plan to space out, physically distance the people who live in these long-term care facilities, whether you can use some of that overflow space, say at the Vancouver Convention Center, to literally reduce the number of people in these facilities so they have a fighting chance.
Yeah, so I think we need to, put it in a bit of context in that we have had hundreds of cases of residents, and that's an important thing. These are people's homes, so it's not as easy as moving people out into an unfamiliar place that we know can have challenges for people, particularly people who have dementia. So it's a very fine balance. We do try and find ways within the home to isolate people, particularly anybody who has illness is moved out. But I also will say there's most people who have this in long-term care, even elderly people, have recovered from it. So, that's the positive thing. There was a beautiful story last weekend of a 99-year-old man who had COVID-19 and he recovered from it. And there's quite a few of those stories. There's many of those stories. So it's not as grim. Unfortunately, the chances of having severe disease and succumbing to it are very high, as we know. So yes, there are physical distancing measures being put in place in homes as best as possible, and looking at how people can be separated from others, particularly if they show any signs of illness. So that is something that is part of the outbreak protocol that we have in place in the long-term care facilities.
So we have time for one more question today. For any reporters that didn't get to ask a question, there will be a statement released this afternoon with all the information covered off in today's press conference. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question today. En français, Dominique Lévesque, CBC Radio-Canada.
Oui, merci pour le ministre Dix. Je voudrais que vous nous disiez en français à quoi on peut s'attendre vendredi matin avec les modèles. Qu'est-ce que vous allez faire vendredi?
Oui, nous allons vous présenter les renseignements qu'on a, les modèles qu'on a. On va discuter de ce qu'on a. On a dit il y a 3 semaines, ou presque 3 semaines maintenant, les modèles présentés à ce moment-là et faire une comparaison de ce qui s'est déroulé depuis ces 3 semaines. On va démontrer et présenter des résultats, le progrès, en quelque sorte, qu'on a fait, l'effet des mesures qu'on a prises, et on va présenter cela au public pour que tout le monde sache ce que nous sachions. C'est le progrès de COVID-19 en Colombie-Britannique et le progrès de nos mesures en nous attaquant à ce problème-là. Donc, on va présenter tout cela. Ce n'est pas un moment, tournant, c'est un moment de renseignement. Nous avons présenté nos renseignements premièrement au Canada et maintenant on va faire on va les mettre au présent c'est-à-dire de dire ce qui s'est passé. On a présenté ces modèles en comparaison avec la situation en Italie, en Chine avant, et maintenant on va démontrer où on est dans le progrès de COVID-19 en Colombie-Britannique et en particulier le progrès de nos efforts de combattre la COVID-19 en Colombie-Britannique. Merci beaucoup.
Thank you.
Thank you very much.
Thank you.